Well, good morning and welcome to our keynote address today, our keynote conversation, excuse me. I am Stacey Frankovich. I'm the program manager for MedHealth, and I will be your moderator for this conversation today. Thank you all for joining us. We experienced our little technical glitch this morning, but I think we're back on track. To our keynote address today, our keynote conversation. I'm hearing my own voice. I am Stacey Frankovich. There we go. Got rid of my own voice. Excuse me for that. So let me start by telling you all a little bit about TechTown and MedHealth. So TechTown Detroit is an incubator, an accelerator, and a co-working space located in Detroit, serving both tech-based and non-tech-based businesses. MedHealth is a program within TechTown that was conceived in 2015. MedHealth is a cross-border collaboration between Southeast Michigan and Southwest Ontario, focused on convening, connecting, and educating the medtech community for the sole purpose of improving patient outcomes through the use of cutting-edge technology. MedHealth is very pleased to offer events that bring people together for very important conversations like the one we're about to have. So with that, let's start. And I am very excited to introduce our first guest today. We're going to be joined by Congresswoman Brenda Lawrence. Ms. Lawrence represents Michigan's 14th congressional district, which includes a portion of Detroit and 17 other cities in Oakland and Wayne counties. Living in the 14th district her entire life, she was first elected to the U.S. House of Representatives in November of 2014. Congresswoman Lawrence is a busy congresswoman. She serves as a co-chair for the Bipartisan Women's Caucus and the Democratic Women's Caucus. She is the second vice chair of the Congressional Black Caucus. She sits on the House Committee of Appropriations, serving on the Subcommittee on Commerce, Justice, and Science, the Subcommittee on Transportation, Housing, and Urban Development, and the Subcommittee on Interior and Environment. She is also a member of the House Committee on Oversight and Reform, where she serves on the Subcommittee on Government Operations and the Subcommittee on National Security. Please, a warm welcome for Congresswoman Brenda Lawrence. We're happy to have you here. We wish we had an applaud track for you. So good morning, and thank you so much for being here today. We know how busy you are. Would you like to just take a few minutes and talk about your work and the things important to you?
I would. I want to say thank you so much for having me here. TechTown has just been transformational in the city of Detroit and in our metropolitan area. And I just want to thank you for everything you do. I want to thank you as our moderator, Stacey, and to my fellow panelists, Lisa. So good to see you this morning. I want you all to know I look forward to discussing how the federal government's response to COVID-19 has impacted local communities as well as the health service sector. In Congress, as it was mentioned, I serve on the House Appropriations, and I want to be very clear about the HEROES Act that everyone's talking about and the president just said he's pulling out of. There's a lot of value issues that you'll see being at play. Our first CARES Act we passed, thank goodness, and America benefited from that. They benefited from enhancing the unemployment. They benefited from a stimulus check to every American. We also provided to the healthcare industry, your hospitals, for your essential workers for PPEs. We also invested in our airlines and the postal service, and we covered a lot. And thank goodness there was bipartisan support for that. Little did we know when we did the CARES Act that this pandemic would last this long. So here we are today fighting over what we feel is a necessary boost to the economy to keep people going back to increasing the employment benefit. Also, I hear it all the time, are you going to give us another stimulus check? We look at the housing situation. I'm very concerned, having gone through the housing crisis a few years ago. When you start having families without housing, you have extreme poverty at that point. Food, who knew we would have food lines in America? And that was just troubling to me, where people would sit in line for a box of food that may last a week. Um, so the need is there. But one thing that is a big bone of contention right now with the negotiation is the support to our states, municipalities, our cities. I was a former mayor, as you know, and I am clearly aware that this virus has had a direct impact on the budgets of cities. The fact that we had additional police runs, the fact that we had COVID outbreaks in our essential services like fire and police, the overtime was out the window. And if a city large enough like a Detroit, Grand Rapids, that Warren, that has a health department, oh my goodness, it has just been overwhelmed with trying to provide testing, all of the other things that we had to do. It wasn't like, okay, we'll just do this. And we should recognize that, because every city, and I'll wrap up with this, every city must balance their budget. It's not optional. It's not like, that was my biggest transition when I went to Congress. It's like, where's the budget? Are we following it? Are we over? We just say we have debt and keep going. But cities must balance their budget. And so when we have this fight about unfunding the police, if we don't get money into these cities, the largest line item in every city is public safety, and that's your police. I went through that when we had our economic crisis before I left the mayor's seat, and you have to reduce that cost, and that's defunding the police. So we're going to continue this, and I'll stay here and answer any questions. And thank you. I still love America. I think she's amazing. As this is very trying times for me, because my belief in democracy is being challenged every time I turn around. But I still love this amazing country, and proud to be a congresswoman.
And thank you so much, Congresswoman Lawrence. We really do appreciate the hard work that you're doing for the people of Michigan and the people around the country. We are all in such a unique, interesting place. And everything that you just mentioned, from housing to food lines to police and safety, all plays into health. They all have an important role to play into health. And with that, I'm going to bring in Lisa McLaughlin, and we can get a little bit more of this conversation going. So let me introduce Lisa McLaughlin, who's here with us. Lisa is a social entrepreneur and the co-founder and CEO of Workit Health, a behavioral health company providing expert evidence-based addiction care through telemedicine. She is a fierce advocate of wellness and well-being programs and a visionary in the delivering of technical solutions to behavioral challenges. Lisa has led Workit Health's initiative with the National Science Foundation and the National Institutes on Drug Abuse, through which she developed digital interventions to solve for social determinants of health and algorithms to measure and predict substance use recovery. So much of this is relevant for this conversation today, and we are thrilled to have Lisa join us. Hello, Lisa.
Hi, so I'm honored to join you, Representative Lawrence. It was wonderful hearing more about the HEROES Act, which is on my mind and every social worker's mind in the state of Michigan. And I'm so thankful to be here with Stacey, because I've benefited a ton from Tech Town programming as an early entrepreneur at every step of the way. It allows me to understand government in Michigan and what's going on that's impacting Workit Health. So really my business started in 2015 because I'm a person in recovery who got sober in 2002 and then saw 40 close friends, brilliant people of all walks of life pass away. I'm a native Detroiter, and I'm lived all over Metro Detroit, but really saw people mismatching with care settings and struggling with social determinants of health. And so my business is all about bringing that care to people in their mobile phones when they're socially isolated. So what I'm most excited by is that this conversation really brings to bear how much digital health and telemedicine has changed Michigan in the course of the past few years. And that's been enabled by sweeping reimbursement reform at the federal level, all the changes to telemedicine law that we saw, as well as just COVID related policy that's really enabled us to get to treatment deserts all over the state and all over the country. We now serve 34 million lives. So it's an exciting time to see some of those tailwinds that are leading to social good, because I know they're leading to a lot of economic despair and isolation for so many, but there are some things that are pushing forward on the innovation side.
Yeah, you're doing great work, Lisa, and we really thank you for being here today and participating with us in this really important discussion. Let's move into some of the questions that we have for discussion and see where this path takes us today. So let's jump in. So Representative Lawrence, this question, we'll start with you on this. We are experiencing an unprecedented health and financial crisis, as we've already established this morning and talked about. We do believe eventually that our health and economic outlook will improve, but in the meantime, what actions are the government taking now to ensure businesses can be more resilient in the future? And I know you talked a little bit about the different things going on right now, but maybe you can expand upon something that's a little bit more specific to businesses becoming more resilient.
Well, there's a couple things. I love the fact that Lisa's talking about telemedicine and incorporating technology to give mental health to a desperate community. Mental health, the COVID. I want you to think about something. I was watching the response on TV, and Lisa, I know that you're uniquely observant, but there were a number of people who came on TV and just the grieving from the pandemic, the grieving of losing someone, the helplessness, the disconnection during death that we normally have. All that is playing out. Losing your home. I had someone call me that I knew from another part of the country saying, I'm homeless. What do I do? I can't work. I lost my job. Can you help me? All these things are just piling up. And so when you start talking about the business community and small business, and, I just spoke to a friend of mine. He said, I bought this building to run my business out of, and nobody's here. And I have to pay the rent. And I'm just sitting here going like, what is happening here? What's going on? Do I sell my business? Do I, what do I do? So a couple of things we realize in Congress. First of all, the supplement of funding for economic development, where we're seeking to infuse small business loans and grants, because every time I say sometimes loans to small businesses, they go like, really? I'm barely paying my bills. I am not taking on another loan. And so that is something that in the HEROES Act that in the CARES Act that we were very sensitive to. And that and the housing and the rent as far as leases and, think about our restaurants who Detroit, that was our comeback. If you went to all the small businesses that were opening and these new restaurants, and we had so many who had just had their grand opening and then had to shut down. How do you sustain that? How do you pay your rent? How do you, your employees who are off work, for us to say as a government, we will, pay their insurance. So you won't be burdened with that. And we won't have people walking around without insurance. It's so many moving parts to this pandemic. And I think, you add on top of a pandemic, the social effects of that, and then you add an election on top of it. This has just been total chaos. I might have to call you, Lisa, because this is, if you talk to the members of Congress, none of us are sleeping at night because we can't turn it off. But we recognize our small businesses. We have to support our economy. And one of the things that I'm proud of is the fact that I am a member of the Progressive Caucus, and I'm a member of New Dems. So New Dems are these strong economic agenda members who feel that we have to infuse life into our economy. And the progressives are the ones that believe in giving health care to everyone, to make sure that our environment is safe and all those things. That's who I am. And some people think you have to be one or the other. I feel strongly you have to have both. I'm a mayor. You have to have a strong economy so that you can support this, to take care of the social needs. And if you're creating jobs, you're supporting the social needs of America.
Absolutely. Thank you for that very thoughtful answer. It is such a large and cumbersome issue with so many moving parts, as you said. So thank you for that. And Lisa, I'll jump in with you and ask, so how has the financial crisis impacted your business? And were there government resources that you were able to tap into that helped you continue on your path?
A ton. So we would not be here, and we would not be the company we are today. We have 63 employees, expected to grow to 200 next year. We really have seen fundamental support that we would not be here without. So the shape that took for us really, and it's hard to talk about it in the context of the restaurant owners you brought up, Congressman Lawrence, because my brother-in-law worked his way up from a server to owning, managing a business, a restaurant, to eventually having a tiny piece of ownership. And now it's just painful watching him losing everything while there's all these tailwinds to telemedicine. But what comforts me about that is I'm realizing that an additional social determinant of health is information, and we are becoming like the roads to connection and community that people don't have at this time. And that's what is propelling so much energy into what I do. So specific programs. So, Workit received block funding in Michigan and California through funds from the 21st Century Cures Act, which covers care for safety net individuals. That's been pivotal. It's allowed us to reach the uninsured, people really cut off from support. And they've been like, whoa, how are you here? How are you existing? This is incredible. We received a PPP loan early on because we had all this infrastructure. The state of Michigan was working with us to get a big office and expand. And we were like, whoa, we've got these leases. And we went all telemedicine. So it was like we had these weird situations like you were discussing where we had just started investing in our growth here in Michigan. And then there's a huge blow to that plan, at least. Workit continues to actively apply for SBIRs, and MEDC supports us in that. So we get a lot of support with like Emerging Tech Fund. When we apply for a grant from the NSF, there's a beautiful matching program. And then the other key drivers are just other resources from NSF and NIDA that enable us to push the science agenda forward in our field, that enable us to basically accelerate the innovations in our field that allow us to treat more sooner with more automation, because so many are in need. And for instance, when we launched the platform, there were 4,000 Wayne County uninsured members that were trying to get in, and we hadn't grown into Wayne yet. We started in PIHP 10 or a different PIHP, and it was just really painful to have this like weird dance we were trying to do to reach these people. But now there's been innovation from regulatory changes that has enabled us to bill Medicaid directly for people all over the state, which is just game changing for those people. So that's how it's played out for us. We're really grateful for programs, and we have a whole list of acts that we follow in the Senate and the House that are related to telemedicine first person visits and removing those requirements to enable fully virtual programs, especially for older adults who are immunocompromised over 60 and really should not be going out to care settings if they can avoid it during these phase 3 kind of settings.
Exactly.
I
Thank you so much.
I
Lisa.
just wanted to add that the CARES Act, Congress appropriated $425 million to Substance Abuse and Mental Health Services Administration to increase mental health services through the CBC, the Certified Community Behavior Health Clinics across the country. These clinics provide comprehensive crisis intervention for mental health and substance abuse. And I just have to shout out my senator, Debbie Stabenow, who's been a real fighter to continue to increase funding and make sure that mental health is always a part of our appropriations agenda.
Mhm.
That's wonderful.
Absolutely, and it has to be. And I know we're going to talk a little bit more in detail about mental health coming up as well, although we addressed a lot of it here. So, but let's kind of come back to COVID for a minute. Let's talk about Detroit for a minute. Detroit was really hard hit by the pandemic, and we were hit early. And really what it did was it just exposed so many cracks in the system, and our most marginalized populations, which specifically our Black communities, our senior communities, were so hard hit by this. Congresswoman Lawrence, can you maybe expand upon a little bit how the health systems are able to work with government or private industry to bridge these gaps and help us to close the cracks that were exposed a little bit and make sure that our most needed populations are being taken care of the way they should be?
So I've shared with people that COVID just ripped the scabs off of so many open wounds and exposed open wounds in our society. So when I started getting the numbers when COVID was ramping up, and I saw these deaths with African Americans, and it was so disproportionate, and I could why is this happening? And I got the answer, well, Black people have more underlying conditions. They have more diabetes and hypertension and heart disease. So that's why they're dying. And then it was said okay, next. And it's whoa, wait, let's step back here. Why is it acceptable to say that you have one race of people in this country? Because the Native American, our native tribal lands, Hispanic communities were in Asian. So it was African American, Hispanic, Native American, and Asian community who make up the bulk of the deaths, and disproportionately for sure, from COVID. And so that goes back to why, and that gets back to our community health centers. Are we really providing healthcare, equal healthcare in America? When we have this debate about Medicaid for all, healthcare for all, we're going to have to, and mental health is included in that, because mental health has gotten to the point, unless you're wealthy, and I love what you said about the information. There's so many people who need their services for them. They just don't know how to reach it. And it breaks my heart. But when you talk about COVID and this issue of healthcare, why aren't, maternal mortality is an issue that we're dealing with in America. Who knew one of the most advanced medical countries in the world is leading in deaths related to pregnancy? And then you hear things, well, the poor people don't come and get their prenatal care, or so why it's happening. One of the leadership philosophies I have, you can only tell me what the problem is once, and then I expect you to start fixing it. So stop telling me what the problem is. Stop telling me that Black people or poor people, they don't get good health care. Well, let's look at why. Their diets are awful because we have food deserts. You look at their ability to live in housing that is conducive to human beings. You walk in some of the homes with the asbestos, the lead, and all those things, And so they're naturally going to be exposed to health crisis. The issue of water, Stacey, if we're telling everyone to wash their hands and to make sure that you drink so much water a day, and then you have people, we're turning off people's water,
Right.
human beings. And water is not a luxury, it's a necessity to live, and we turn it off.
Right.
I mean, we can't run our water system without funding, but we got to resolve this. Don't keep telling me that. We've got to fix this. And so in the HEROES Act, you know, putting a moratorium on shutoffs, making sure that we have assistance for rental, and then to use COBRA to assist small businesses to keep families on health care. And so it's all these things that we kind of knew were there, but COVID just pulled the scab off of it.
It sure did. And I think you've really hit the nail on the head with, you know, all of what we're talking about here today with fresh water, fresh food, information, financial stability. It is all a healthcare crisis. They all connect, and it is a healthcare crisis. So Lisa, I'm going to kind of throw not quite the same question back to you, but seeing such disparities in our healthcare, do you see that as well in the community of in the addiction community and in the community in mental health and in what you're doing? Do you see the disparities as well?
Oh, for sure. So many times I think there's a hope of catching people at like federally qualified health centers that might need addiction care, and then getting them everything they need, getting that mammogram to them, getting all the pieces. But unfortunately, what happens in depression and isolation is that you can barely reach out, and getting to your FQHC feels like a mountain. So I think with like clicking on a link and just talking to somebody enables you to reveal that people have been cut off from primary care for like 10 years. They might have abscesses or teeth that they haven't seen that like could be causing a sepsis or an infection. And then we catch them because the pain and suffering of their addiction has gotten to a point where they just got to try something to make it stop. And then because telemedicine becomes this routing, pathway into all those other linkages in the health system, you start to develop a more modern system where you have multiple pathways into all those services, which starts to solve the information problem. But what we've seen with COVID is a huge increase in suicidation, like suicide ideation. We've seen individuals relapsing after 20 years of recovery. So I've been in recovery since the 90s. I finally got sober in 2002. And I'm seeing some of the heavies in our community that are like, typically we use those people that as lights in the recovery community, and like somebody with 20 years like myself, people cling to that to like produce hope. And so we're seeing some of those people relapse because it's just, they're used to being in community settings of 20, 30 people at an AA meeting, and they can't. Meetings are limited to 10, and that's okay. Everybody's adjusting, but you do see a lot of fundamental cracks in the recovery ecosystem, which then impact the people that are shepherding the other people along that are not as far along. So I think telemedicine helps a lot with the knowledge management of spreading out all the resources we have in the state. My friend Sachin posted a really like profound tweet the other day where he's like, why around these beautiful centers of excellence that we have in our states is there so much despair on a healthcare level? And it's because there's a knowledge management problem. Like Representative Lawrence said, we're telling people these resources are there, but there's somehow the link is not coming through, and that's a messaging problem. So I think with the internet, we have huge opportunities to get the word out in new ways that are where people are, that are at their local liquor store or, in unusual creative places, to spread the word that free services are available for really key things.
And I think you bring up a valid point about access. So when you're providing telemedicine or telehealth solutions, we have huge communities in this country that don't have access to telehealth. They don't have internet. They don't have a computer at home. They don't have a smartphone at home. So it's almost a reversal back to old school, where we have to start talking about home visits or, house calls, if you will. So I know I pivoted a little bit on what we were talking about, and I want to stay on this mental health issue for a little bit longer though, because we're seeing just historic issues, including depression, substance abuse, post-traumatic stress disorder for our healthcare workers, our frontline workers, and as you mentioned, suicide. So, there's a fine line between technology and non-technology solutions, and how can we bring the technology into those that don't have access, or how can we, like I mentioned, kind of go back into old school and make sure that we're getting into the communities that don't have this access. And Lisa, you brought up something too. You mentioned about being at the liquor stores, being a source where giving them the service that they need where they're at. So there's not a tremendous question, I think, in there, but I think we should continue the discussion. And Congresswoman Lawrence and Lisa, either one of you, whoever wants to jump in, just expand upon a little bit about making sure we're able to get that access into those communities that maybe aren't able to get to the telemedicine options.
So one of the other scabs or wounds that were exposed during COVID is that we sent everybody home and said, work from home, learn from home. And then you say, well, wait, I don't have internet. If you're a working mom and, you're barely keeping the bills paid, a roof over the head, and feeding your children, internet is not on your list. It's not on your budget. And then the technology, can you imagine being a child sitting there holding a cell phone, trying to do homework? Or, you're being offered a job and they say, okay, do you have a computer at home? Well, no. And even we closed the libraries, because a lot of children, I know for a fact, I built a library where the children would supplement their access to internet by going to the local library using their technology. So when we talk about bringing the resources to the people, I just want to give you two examples. Domestic violence. There's been so much research, and you will find when you go into truck stops or you go into public bathrooms, there will be a poster on the wall about call this number, we'll help you, where they're trapped. And that's the only time they're alone or with someone, and they can get a number. And if they ever get access to a phone, I can tell you so many stories of women who escape human trafficking and domestic abuse by getting that information. When I first heard the campaign of they went to businesses, will you put this in your bathroom stall so that people can get the information? And then when you talk about having access to information, it's things like water, internet, that so many Americans take for granted. It is not the norm. It is not the norm. And we have to step up, and we have, and thank goodness for philanthropic support, where so many companies stepped in and just gave computers and iPads to students in low-income areas to assist them with hotspots, so that they could connect for education.
I'd love to comment on this one too, if it's okay, because I really resonated with Representative Lawrence's comment. So we see people who are homeless, accessing Workit services in a bathroom in Burger King, accessing it where they're able to get a moment to themselves, which increasingly, to your point, Representative Lawrence, is while they're teaching, trying to work as a medical assistant on their own Zoom, trying to, borrow Wi-Fi from some nearby public hotspot. It's wild, the dance people are engaged in. And what we see is that with addiction services, you get a lot of the same things you were mentioning around domestic violence. And you get like, I need to sneak into the closet because I can't even let my partner know that I've reached this level of despair and that I need this much help, because I know our whole family is under such stress that I don't want to be, the one who tips it into a deeper place. And so you see, I've been shocked to see how important, like I thought what was going to be most important was my profession. Like people are going to love the social workers on our platform and love connecting. They're like,
They do.
they do, but that takes later. First, they love the privacy and the the ease of access. And it's kind of scary at first, right? Because you'll have people texting in while they're driving and we'll be like, sir, please pull over. But I'm glad they're calling. I really believe in harm reduction. I really believe in meeting people where they are, because sometimes the bar is just too high to do what I did, which was walk in and say, hey, I'm Lisa, I'm an alcoholic, help. I got there. I was one of the lucky ones, but we're like 2% of the recovery population. So I'm encouraged to see some of the benefits of telemedicine. We've always been kind of like the ugly stepchild of healthcare. And I think this pandemic is proving out clinically that we're providing a different kind of access that everybody should pay attention to, because it's getting into some of those cracks and providing another way through. But like we see, for instance, I think the most interesting thing is we see people have lower blood pressure at our first visits. Like 60% of our patients, they're afraid of doctors sometimes. They're afraid because they're shamed, or they feel shame about their addiction, to go in. And typically at their first visit, they have relatively elevated blood pressure. And we see a reduction in that because they're in their own space, right? They can be, and so certain kinds of people, that's people who have gone through a lot of trauma, really need those pathways. And that's been really enlightening to me as we've gone through this.
And I think if there could be a positive that may come out of all of this, and we have to try to keep that positive mental attitude, if there is a positive that could come out of all of this, is as you said, Representative Lawrence, the scabs have been ripped off, the wounds are open, but now we can bring air to them, and we can begin to see them heal. And there's an awareness and a compassion I'm starting to see from people who we've all had our heads down for so long, and we're just all working and plugging away and trying to get by and trying to get through. And I think we all had to just sit down for a minute, take a breath, and look around and see what's happening around us, and center ourselves back into a place of compassion and looking out for others. So I certainly have some optimism. I think it'll be a lot of hard work. I think it's going to be painful, but I have a lot of optimism. So let's look at optimism for a minute. Let's pivot to an optimistic future. So we're seeing, with all of these wounds that are open, we're seeing innovators that are pivoting. That's what innovators do. They pivot, they adapt, they try to figure out what's needed, they try to solve problems, and our innovators are doing it. So Representative Lawrence, how do you think med technology and all of what they're bringing to the table, which includes new jobs, new sales, intellectual property into the region, new businesses starting, how do you see this really helping Michigan as a region, the Southeast Detroit area and Michigan as a region, but helping us across the US in just creating kind of the next generation or the future of healthcare?
Well, prior to the pandemic, the Veterans Administration, as you know, had so many challenges in healthcare. And that was my first introduction to telemedicine, because the wait lists, which was just horrific. And the fact that if I can just sit down at a computer and talk to a doctor and to, once I've been diagnosed, the follow-up visits that I need, it has been transformational, and it has really improved the healthcare. So I see that across the country. So to give you an example, when we were dealing with just the healthcare in America prior to COVID and access, our community health centers have just done tremendous jobs, but it's still, Lisa identifies, it's still a segment of our population who are, unfortunately, Stacey, like we said, have all these underlying conditions, who are not seeking care for a number of reasons. They still believe, well, I don't have a job, so therefore I can't see a doctor. But what I'm seeing, like, we have Lisas all over the country. Thank God we have our own Lisa here in Michigan. But the outreach and corporate sensitivity to the educational gap, with technology. Think about, in today's world, you cannot get a job if you don't have some computer skills. I mean, to even run a cash register at McDonald's, you got to understand some fundamental technology things, because it's an iPad that you're operating. That we're educating a better workforce. When we look at food in America, and a lot of you don't realize this, a lot of those food banks were coming from farms that were told to throw away their food, that, with the trade deals, with all these things that happened, food was rotting.
Shocking.
And they had an ability to take that food and get into the community where people, and make money in the process. So, I mean, so many things have happened, but when we talk about the ability to train and to expose all levels of our economy and our citizenry to technology, that's a win-win. And I'm uncomfortable with telemedicine. I'm doing a personal disclosure, but I've learned to use it. I said, oh, that's crazy. I'm not going to talk. What am I going to do? Like, look here, But
it's awkward. It's awkward. We can admit that.
Awkward. But it's becoming more of the norm. But the fact that we can treat so many more people is the absolute benefit of all of this.
Absolutely. Absolutely. Thank you so much for that. I do want to take just a minute to reach out to our audience today to see if they have any questions. You can go ahead and put them in the chat and let us know. But just we have a couple comments that I'd like to share with you both. One is that this is great to hear this conversation about active mental health support on an inclusive community level. So we thank Ronald Wilson for his comment. Ramona says, ladies, this is everything. Thank you. So we love that as well. And she said, Michigan Telemed, we're working on more advocacy. Absolutely, Michigan's working very hard. So I want to be very mindful of everyone's time. So I'll hopefully see if any questions come through on the chat. But I know that we've covered most of the questions I had for you ladies today. But we can kind of go back into kind of the technology piece of it, because those that are here today for the MedHealth Matchmaking Mixer are here with the hope and the dream of having their technology noticed by a health system, a payer, a provider. And let me ask Lisa a little bit about your journey. And you were on a really solid path before the pandemic hit. And of course, the pandemic has exposed all of these mental health issues. So the question would be, did you think that the pandemic opened up opportunities or created even more roadblocks to you going forward? And then I would ask Representative Lawrence if she has any comments on that as well. We want to make sure that we're taking down roadblocks to health technology, not building up more. So Lisa, why don't you go first and let us know how your experience has been?
Sure. Yeah, we recently did a presentation to NIDA on this because they were really interested in how it affects the science and drug addiction. And so what we saw was really huge changes during COVID. So what happened in Detroit is that there was already, as you spoke, we were already on a growth trajectory because CMS was starting to support billing for telemedicine, which meant that you could have Medicaid participants who have the least number of resources access care. And then because telemedicine is more efficient to deliver and has more scalability, we could deliver that care at a cost that CMS can handle, which is really important dance. And so we saw there that we were already seeing Medicaid people discover the awakening of people to telehealth for Medicaid was huge in February. So that started really in February. And then as COVID hit, you had this brief period where it just wasn't safe to open, where you had some of the top rehabs in the country saying, you can come, but you might get COVID, we'll do our best. And And like all the housing and transitional stuff became really problematic because you'd have like an apartment building with people that are in early recovery, and then they're all smoking cigarettes close together outside, and all the stuff that really was really not, you don't want people breathing and doing these things during when COVID really got intense. So the tailwinds that we saw there were really from lack of access to other services that was brief, but was impactful, because it's sort of like when I responded to Katrina during my social work program. It's sort of like when Katrina hit, everybody needed a meeting in the recovery community, like the next day, and every building where you had a meeting was flooded. So it was just like, that's a common thing known in the recovery community, that when disasters hit, we suffer. We have a harder time with stress and resilience than your average American. Tends to be 50 to 60% of our patients have co-occurring anxiety and depression. So what we saw were two things. So on the negative side, we saw, increased isolation, people relapsing at a much higher rate. On the positive side, we saw people really scared for their health, and for the first time in their life, willing to try to recover, because they were suddenly afraid that they're smoking a ton of weed and then they might get COVID because their lungs were, vulnerable. And so it was kind of like when my grandma, who was 73, learned she had lung cancer. She stopped smoking overnight, because that was just her limit, and a lot of people had that response and were willing to do, like, I'm going to take the first step. I'm going to get in the game because, the stakes are higher. And so I think we saw both things. But for medical technologies, things like telemedicine being available, no originating site, ability to deliver it anywhere. If you have a protocol like ours, like I agree, Representative Lawrence, there are some things it's just not appropriate for. But for something like what we do, where if you were to go to a federally qualified health center, all they would do is take your blood pressure and start your treatment. If that's all that's happening in a certain clinical pathway, then you're not missing anything, right? If you're a prostate cancer doctor and you can't investigate where someone's at, then it's totally different, So I think it's specific, but I think we've kind of thrown the baby out with the bathwater a little because of those scary use cases that really make us all cringe. And I'm excited that people are seeing it in a more nuanced way and seeing these really targeted situations where tech can help a ton.
Well, and Lisa, we just had a question come in, and Representative Lawrence, I think this question will tie right into to your response to what Lisa just said. And so having telemedicine and having access to the internet, do we see a future in which the Medicaid may include that as part of their package for some of our recipients, where Medicaid will actually cover either the equipment or the internet needed to see a health professional through telemedicine and have that be part of the package?
I see the government, I can tell you, we see the need to include in our social services the ability to provide access to the internet and to technology. I don't think it will come under Medicaid because it's kind of a clean space for health. There were fees to log on to something. I can see that being covered under Medicaid. But I just want to use this moment to connect the dots. So we have Lisa's this amazing healthcare provider who has committed her life and just transformational change. But let's connect the dot to government as we talk about telemedicine. So the Federal Communications Commission, FCC, government, appropriations, allocated $200 million in grants to disperse to providers across the country who plan to do a start up a telehealth program. So that's how we direct the funds. So FCC, give access to, particularly to those who are saying we're going to start a telemedicine program, because we understand the importance of it. So where it's not in Medicaid, it's in FCC to assist people. Excuse me, assist people like Lisa. Thank you. Who will do the telemedicine. So one of the things that, and we're here today on a Zoom. That's been one of the critical issues because Lisa's hit the nail on the head. It's a communication crisis. So normally we would go to a homeless shelter, or we would go to a community center, or we would go somewhere where there's a mass of people. So now if you don't have a computer or the technology to be on this Zoom, are you getting this information? So that's going to be one of our challenges. I pray to God that COVID takes a nap and we're able to start gathering and we get it under control, we get a vaccine so that we can start back again. But that's one of our biggest problems right now, getting to the people, the information.
Absolutely, absolutely. And I think that's a big part of the reason the health crisis hasn't been fully managed is because the information pathways are clearly broken.
Mm-hmm.
Well, I want to thank you both. We are about out of time, but I have so enjoyed this conversation. I would like to give each of you just a minute for any final thoughts or remarks, and we'll wrap things up from there. Congresswoman Lawrence, any final thoughts?
I just want to take this time to thank Lisa, to celebrate your slaying the dragon of addiction and your battle every day. I just want to congratulate you and encourage you. Thank you so much for what you do to transform lives. Stacey, TechTown is so needed. We need to continue to provide a platform for these small businesses that want to engage and give them the resources and the space to survive. And to everyone listening, I want you to know that this is we had no control over history picking us to be here at this time of this crisis in our country. But we celebrate and we talk about all these other historic figures that when crisis hit, they stood up and they made a difference. And so to Lisa, you're going to be written in history as one of our heroes or sheroes. I just want you all to know that we all play a role in this. If it's nothing more than just picking up the phone, checking on each other, please be safe, wear your mask. Understand that this virus is about us taking care of each other, not just ourselves. And that I believe in this country, and I get up every day and fight and do everything I can because I believe in one nation under God, indivisible, with liberty and justice for all. Be safe, and I hope to see you all soon.
Oh, thank you so much. And Lisa, any response to Representative Lawrence's kind words there?
Oh, I'm so grateful to be here. I have been for a long time a huge fan of Representative Lawrence. So I'm excited to start to be able to create this forum. And thank you to TechTown for letting us start to draw these tight connections between these policies and the work that we're doing. People tell you this as an early entrepreneur at a TechTown meetup, you're going to have to think about government. And at first you're like, I can't do it yet. But as I've gone farther and farther along, I see how pivotal it is to social change. And it's really exciting to have the kind of community that's trying to foster that kind of, beloved connection and beloved way of drawing it all together for our state. And so I'm honored to be here, and I'm honored to work with both of you on this. This is wonderful.
Well, I can't thank you enough. I second what Representative Lawrence said. Lisa, you're a hero. Congratulations on your sobriety and slaying that dragon. I am in awe to be in this Zoom room with two such strong, amazing women. This is a highlight of my life right now. And thank you so much. And Congresswoman Lawrence, keep fighting. I know you are. We need you there. We're proud of you. And we are behind you 100%. Just know that we are fighting right there with you. Thank you so much. We appreciate all of your time today. This has been great. Thank you.
Thank you.
Thank you.
Thank you. Bye-bye, everybody.